My name's Cara Rushing. I'm a family nurse practitioner here, and I've been here for 2 years.
My name is Lorraine McDowell, and I am the lead nurse practitioner at the East location of Good Samaritan Health Center.
Something that I really enjoy about family medicine is that you do see everything from a child who's a year old to seeing people in the geriatric population.
I think we treat the whole patient. I think a lot of places do that, but I don't know that a lot of places add a spiritual component into that.
I think a big thing that Good Samaritan has to offer for their employees is the fact that we are not insurance driven. And so I think that changes the way that we are allowed to interact with our patients, the way that we don't push services potentially on our patients, the way that we can take our time with our patients, and that we don't have this kind of overhanging idea of the corporate insurance bubble over us. I think that is a huge weight off of our shoulders as practitioners and allows us to really focus on the patient as a patient instead of thinking of, okay, well, what kind of things can I claim to build to the insurance for every patient, which I think is a really freeing ability to be able to just take care of the patient for who they are and what they're here for.
We follow that golden rule of treat others as you'd want to be treated, and I think we do a good job of that. With a patient population that's vulnerable in the community, you have people who are uninsured, potentially undocumented, unemployed, or having lower income and just don't have the financial means to get care somewhere else. So I feel like patients are able to come here and it feels like a private practice, so it doesn't feel like they're being treated as less than. They are treated with the dignity and respect of someone who can pay full price even though they don't have the means to do so.
With the Good Sam Fund, we can specifically say, okay, this person can pay $20 for their visit today, and their visit costs $90. So what we are going to do is we are going to cover $70 and give specific amounts of, I know that you cannot do this, but today for this situation, we are going to give you this extra handout. And that's, I think, a very unique perspective instead of saying, well, we've already decreased the cost, so much, and we can't go more than we can already do. It allows us to really go that extra mile and that extra length to really meet patients where they are.
The impact that it's making on our patients is amazing. We can help patients, afford, blood tests to further evaluate, or help them to just pay for the visit or supplement paying for the visit. That is, sometimes it's the difference between getting care and not getting care. A lot of our patients are making a decision whether they're going to get groceries or come to the doctor, or if they're going to be able to pay all of their rent and come to the doctor. So if you're considering making a donation, just know that your valuable donation is going to help people in our community that you may walk by every day and not realize that they have a financial need. So just know that they are coming to a place where they are loved, where we are trying to, love as Jesus loved us. We love on our patients, and we provide care that is quality, competent care. It's not just pushing people through. We spend the time that's needed to get to know our patients, and we follow them through the lifespan. If we are so allowed to do so, if they will let us, we will do it.